You may be wondering if there is an essential oil for MRSA. This article will discuss what essential oils are and their properties and why they are good for you. We will also discuss the cause of MRSA, how to find the best essential oil for MRSA, and how to use it. Hopefully, you will be able to get some benefit from it. If not, keep reading. You may be surprised. What are essential oils? The topic of antibiotic-resistant bacteria is a huge concern these days. Millions of illnesses, deaths, and billions of dollars are spent annually because of antibiotic-resistant bacteria. Unfortunately, the topic of antibiotic-resistant bacteria is so complex and difficult to understand that many people under or overanalyze it. However, this article will address the power of essential oils as an antibacterial treatment. While there is still debate over how effective essential oils are, they do seem to have several benefits. While essential oils are not pharmaceuticals, they do have antibacterial and antiviral properties. Several essential oils have been found to have antimicrobial properties and are used as preservatives in the food and pest control products. They can also be used for external and internal applications. In fact, there are companies that sell essential oil capsules. But not everyone is familiar with essential oils. Some farmers are already experimenting with them on their farms. In vitro studies, essential oils have been found to inhibit the growth of gram-positive bacteria. Using essential oils as antimicrobials, however, may be more effective than taking antibiotics alone. This is because essential oils can work by disrupting bacterial cell walls and cytoplasmic membranes. These results can reduce the number of antibiotics required for treatment. Interestingly, the lavender essential oil was found to kill E. coli while cinnamon essential oil reversed the antibiotic-resistant effect of piperacillin. Besides their antibacterial properties, essential oils have been used for centuries in medical settings to treat a wide variety of illnesses. Fortunately, there are no clinical trials proving their efficacy. One study even showed that the essential oils containing polytoxinol could significantly reduce inflammation in burn victims. However, further human studies are needed to confirm the efficacy of essential oils as an antimicrobial treatment. Essential oils can also be effective as a treatment for MRSA. A combination of tea tree oil and geranium essential oil was found to have antibacterial effects when used together. The combination of these oils had the most effective results. If you're concerned about essential oils for antimicrobial treatments, it's important to consult a medical professional. But what if they're not effective? Properties of essential oils. Antimicrobial agents are the lifeblood of any healthy body, and essential oils contain several compounds that have antimicrobial activity. Many studies show that essential oils can restore the antimicrobial activities of antibiotics. Listed below are some properties of essential oils that are helpful for treating infections, including MRSA. These oils may also have other useful properties. They have many uses, from cooking and personal care products to medicine. The following is a brief review of some of the most promising essential oils for MRSA. Cinnamon and thyme essential oils are especially effective. Staphylococcus species are common skin inhabitants, but they can cause infections in immunocompromised people. Antibiotic-resistant strains are difficult to treat, but essential oils can be used as cheap and effective treatments. The use of antibiotics should be curbed to minimize the spread of new bacterial strains. Fortunately, many essential oils are natural and inexpensive. The main components of essential oils are terpenes, aliphatic acid esters, phenolic compounds, and oxygenated derivatives of these molecules. Several of these compounds are hydrophobic, meaning they can partition with cell membranes. Hydrophobic essential oils have an antibacterial activity that can kill bacteria by disrupting the membranes of bacterial cells. Others target the efflux mechanism in gram-negative bacteria. Because essential oils contain many chemical compounds, it is impossible to assign each one's antibacterial properties to a single compound. Rather, each EO may act on multiple targets in microbial cells, and this synergistic effect can help the antibacterial properties of essential oils. The synergistic effect of EOs may result in an even stronger, more potent antibacterial effect than the isolated component. There is growing interest in using essential oils as natural antimicrobials for MRSA. One such study used herpineless cold-pressed Valencia orange oil against MRSA in vitro dressing models. The antibacterial effect of this oil was noted in 5 bacteria in the study. However, further clinical trials are necessary to confirm these results. While EOs are a useful tool for treating MRSA, further research is needed to confirm the effectiveness of this treatment. Cause of MRSA. There are several potential causes of MRSA infection. MRSA USA 300 is the most common genotype and represents a significant percentage of healthcare-associated and nosocomial BSI. MRSA USA 300 poses unique challenges to infection control programs. For example, this strain has a high prevalence in hospitals in Atlanta, Georgia. Infection prevention efforts should include a systematic approach to the emergence of MRSA and its potential to spread among healthcare workers and the public. MRSA is most common among people in hospitals, but it can spread to the general population. Certain wards are more at risk than others. Those with HIV or open sores are more likely to develop MRSA infections. Skin infections can also be a potential cause of MRSA because MRSA can be transmitted through thin flexible tubes. Once infected, MRSA can cause severe infections and may even lead to the death of a patient. Although there are many potential causes of MRSA, it is thought that lapses in infection control, including the failure of doctors to wash their hands between patients, are contributing factors to the outbreak. Antibiotic resistance has also been attributed to increasing the number of nosocomial MRSA infections in hospitals. According to David G. Armstrong, MD, Chair of the Department of Medicine at Winthrop University Hospital, New York, the overprescription of antibiotics among humans is one reason for the rise in MRSA. He also links this phenomenon to antibiotics as growth promoters in the livestock industry. Although MRSA is common in hospital settings, many people are carriers of MRSA without realizing it. They may be carrying the bacteria without realizing it. If you have an infection caused by MRSA, you may have several symptoms, including fluid drainage and warmness to the touch. In addition to these localized symptoms, MRSA can also spread throughout the body. It is best to get medical treatment as soon as possible, as the infection can be life-threatening. The original cases of MRSA infection occurred among indigenous people in Western Australia in the early 1990s. These strains were distinct from the prevalent hospital strains and were susceptible to most beta-lactams. These outbreaks were also observed among healthy children. The epidemic continues to evolve, but in some communities, the outbreak has caused the emergence of new, more resistant strains of MRSA. The main cause of MRSA infection is the outbreak of MRSA. best essential oil for MRSA. Essential oils have long been used as medicinal remedies, and they have recently been found to be highly effective against deadly MRSA bacteria. According to University of Manchester research, 3 essential oils are particularly effective against deadly bacteria, as well as many other types of bacteria and fungi. Essential oils are not oily liquids but instead are concentrated liquid extracts from plants. They contain unique chemical profiles that are highly effective against bacteria, fungi, and viruses, and are used in various products to fight infection. Tea tree is a generic term for several varieties of tea tree, including the genus Melaleuca alternifolia. Oregano oil is the big gun of the infection-fighting oils, containing a naturally occurring phenolic compound called carvacrol. In one study, carvacrol was found to be more effective than 18 commonly prescribed pharmaceutical drugs. It is a very effective antibacterial and can be inhaled to prevent the spread of MRSA bacteria. Tea tree oil is another popular essential oil for treating MRSA infection. It contains more than 100 unique chemical constituents and is considered the best essential oil for MRSA treatment. Various studies have found that tea tree oil is superior to standard medical chlorhexidine treatment and silver preparation for killing MRSA. Compared to other antibacterial drugs, tea tree oil is a safe alternative to drug treatments. Tea tree oil is most effective as a topical treatment and is used in natural hand soaps and sanitizers. The best essential oil for MRSA treatment depends on the type of bacterium. For example, essential oils containing thyme and cinnamon have antibacterial properties that can effectively fight the bacteria. The 2 herbs are particularly effective against Staphylococcus species, common skin residents, and can cause infection in immunocompromised people. Antibiotic-resistant strains are notoriously difficult to cure, so essential oils are an affordable alternative. Eucalyptus oil is another option. Applied to the wound, eucalyptus oil has a positive impact on the bacteria. The antimicrobial effect of this essential oil is equivalent to that of 18 antibiotics and is more effective than other treatments. In fact, EOs have a significant impact on the growth of MRSA, and may be a major step toward improving healthcare facilities' outcomes. Next, essential oil for pancreatitis. Legal and medical disclaimer: information provided on the site is for educational purposes only, and does not substitute for professional medical advice. You must consult a medical professional or healthcare provider if seeking medical advice, diagnoses, or treatment. We do not provide any medical advice. Essential Oils Marketplace. Thanks for watching. Please subscribe.